Any man suffering with erectile dysfunction can be a good candidate for a penile implant. That includes people who have tried the pills and don't like the pills, or the pills don't work anymore for them. But really, any man who has erectile dysfunction can be a good candidate for a penile implant. Both Medicare and many of the other private insurance companies will cover the penile implant. Our office will work together with you to ensure that you are covered prior to surgery. There are really two main types of penile implant that are available for use in the United States. The first type is what we call a malleable penile implant, and this is basically two rods that we install into the penis that are rigid, but you're able to bend them up and down. So how these work is when you're ready for intercourse, you bend the penis up and it stays in that position, and then when you're done, you just bend the penis back down. Then we have the inflatable penile prosthesis, and this is really the gold standard for penile implants in the United States. These are what we recommend to most of our patients if they're able to function the pump. So the inflatable penile prosthesis looks like this. Here's where you have the pump, and this is what goes inside of the scrotum. This is what you actually push to inflate the device and give yourself an erection. Then you have the reservoir, which is up here. This is what we put inside of the abdomen or underneath the muscle. And then we have the two cylinders right here, and these are what actually get hard to give you an erection. These two rods go into the penis and fill up with saline to give you that hard, firm erection. All of these components are all concealed underneath the skin. You won't be able to see them from outside unless you're really looking for them, or if you're actually feeling down in the scrotum to feel for this pump. Nobody's going to know that this is in there. How it works is whenever you push this pump, saline moves from this reservoir into these cylinders to actually give you a hard, rigid erection. And then when you're done, you push this button right here, just above the pump, to release the saline from this two cylinders back into the reservoir. Penile implants come in a variety of sizes to match every man's exact physical dimensions. To measure the penis, during surgery, we actually put the penis on maximum stretch. And this enables us to get the biggest size that we can possibly place into the penis. It is very important to see a sexual medicine specialist or somebody who does a lot of penile implant procedures, because we are trained to give you the biggest size that you can possibly get that we can fit into the penis. The 3-piece inflatable penile prosthesis is actually very easy to operate. So first you have this pump that sits inside of the scrotum next to the testicles. This is just where you press to inflate the cylinders in the penis. You just continue to push this until the cylinders are completely rigid and you're satisfied for erection. You can't really over push this pump, so don't be scared to keep pressing. And then you have the release valve, which is controlled with this button right above the pump. So to release the erection, you just hold down on this button and the erection releases, all the fluid moves back out of the cylinders. After the penile implant surgery, we completely expect your erections to be satisfactory, and then your ejaculation and your sensation to be exactly the same as it was before the surgery. The penile implant is completely underneath the skin, and nobody's going to be able to tell that it's there without actually touching and feeling into the scrotum. So if somebody's just looking at you and they don't know that you have it, even if you're naked or in the shower, nobody's going to know that it's there. The penile implant is made out of a silicone material. This is a very safe material to use. It has very little effects in the body, and it is able to conform to a person's penis and look extremely natural. The inflatable penile prosthesis is inflated with normal saline, which is just a saltwater solution. It is a closed system, so there doesn't need to be any kind of refilling or anything like that. The system is a closed system, so once it's installed, there's no maintenance to be done. So the penile prosthesis is actually implanted through a very small 4-centimeter incision that we place between the penis and the scrotum underneath the penis. So this is a very concealed incision with very minimal scarring. We do the entire procedure through this 1 4-centimeter incision so that the recovery and the pain is very minimal. So we expect the majority of your recovery to happen within the first 1 to 2 weeks. This is the time when you are going to be a little bit sore, but we will have pain medications that will help with that. After these 1 to 2 weeks, depending on your job, you may be able to go back to work. The full recovery is a 6-week period, but really those first 1 to 2 weeks are the time where you do need to take it a little bit easy, and that's when the majority of the recovery will happen. At 6 weeks, we really expect you to be completely healed, and that is when we will teach you how to use the device and give you the green light to go ahead and use it as much as you see fit. These devices are extremely durable. However, they are a mechanical device, so they do have a lifespan. Depending on how much you use it, we expect it to last anywhere from 10 to 15 years. We normally tell patients to expect them to last about 12 years before any kind of device failure would happen. Satisfaction rates for the inflatable penile prosthesis are extremely high. It really has the highest satisfaction rates out of any treatment for erectile dysfunction. The satisfaction rates for men is up to 98%, and then for the patient's partners is in the high 90% as well. Of course, just like any other surgery, there's going to be risks involved. Risks such as pain or bleeding or infection. The biggest risk that we worry about is infection. However, in the hands of an experienced penile implant surgeon, this risk drops to less than 1%.